Thank you so much. My name is Fazwadia Annette. My reg number is 2321997. I am a group 1 member and I have an assignment of applied immunology, and it's one that I'm going to talk about. So I have a presentation outline that is the principles behind agglutination reaction and how the latex agglutination is done or works in diagnostics, and then the main types of vaccines, and then how the herd immunity is done in immune, like disease prevention, and the differences between active versus the passive immunization. So the first question is the principle behind agglutination reactions, and as we know, the principle is the antigen antibody reaction. Here the antibody IgM or IgG, it recognizes and binds to the antigen on the surface of the cells or microorganisms, forming the visible particles or aggregates. So here there is a diagram that shows it well. This is the antibody and the antigenic material. They bind together to form visible aggregates, or that is the antigen antibody complex. So it's applied in blood typing or infection diagnosis or detection of the antibodies. The second question talks about the latex, how the latex agglutination works in diagnostics. As we know, latex agglutination is a diagnostic test where the antigens or antibodies are attached to the latex bits to enhance visibility. So we have the procedures. The first procedure we use is the coating the latex bits with the antigen or antibody. This is the first step, and then they add they add the sample. It may be the antibody, and then when they bind to each other, they form the visible clamping, or indicates the presence of the target. Here there are also the diagram that shows the latex particles and the antibody. When they bind, they form the agglutination. So it is applied in some places like the pathogen detection, for example streptococcus or Neisseria meningitis or rheumatoid arthritis. And then I have the third question talking about main types of vaccines. So the first one, we say the live attenuated vaccines, where it weakens the pathogens and then it induces the strong and long-lasting immunity. It has examples like measles, mumps, rubella, or the BCG for tuberculosis. And then for it has a limitation, like it is not like safe for the immunocompromised individuals. That's to mean those individuals who can't be vaccinated. So we have the second, which is inactivated vaccine. It is for it kills the pathogens, and it may need boosters. This is to mean like it has like this vaccine is not safer for the people who may require some vaccines, some boosters for it to work. So for example, you have polio or hepatitis A, and then you have subunit recombinant or conjugate vaccines. It has specific antigens only, and it has side effects like fewer. The side effects are less. So the examples are hepatitis B and hepatitis PV. And then we have toxoid vaccines. Toxoid vaccines, they have inactivated toxins from bacteria, for example tetanus or diphtheria. mRNA vaccines, they also instruct the cells to make their antigens. and this it is rapidly and effective. For example, you have COVID-19. Here we have the fourth question talking about how herd immunity helps in disease prevention. So the herd immunity, it's a population level immunity that reduces disease spread. So it has ways how it does it. It protects unvaccinated individuals, and it also interrupts the transmission chains, hence making it less spread. So it also have the diagram showing how herd immunity works, whereby if only a few people are vaccinated, the disease will be spread like very fast. But if lots of people are vaccinated, the disease can't be spread very far. It's less, so the community stays safe. We have the fifth question talking about the differences between active and passive immunization. For the active immunization, it stimulates the immune response, while the passive immunization, it provides preformed antibodies. And also the active immunization, it provides a long-term or lifelong immunity. And while the passive immunization, it's a short-term, like weeks or months, that that's its duration. And active immunization, it has examples like measles, mumps, or rubella, or hepatitis B, while the passive immunization has antivenom or monoclonal antibodies. Here we have a conclusion talking about all those we said above. It includes the immunology bridges, diagnostics, and prevention, and technologies like agglutination and vaccines saves lives. Herd immunity and immunization are key to public health. Thank you.